Patients killed and harmed, doctors not fit to practice, and serious misconduct unpunished. These are just some of the claims levelled against the Queensland health system by a former member of the watchdog set up to oversee medical practitioners in the state. And authorities have been slow to act on the controversial claims. John Taylor reports from Brisbane.
For more than 3 years, Jo Barber worked as an investigator with the Medical Board of Queensland. Between 2007 and mid-2010, it was her job to look at complaints and cases of alleged wrongdoing by medical practitioners. Her claims are shocking.
I know people are dying in hospitals as we speak, and that they're being harmed by doctors who are working outside their conditions of registration, who are working in an unsafe way because the doctor themselves believes they're okay, but they don't have the right supervision.
Jo Barber wants people to be held to account, like a doctor who, she says, caused the premature death of a patient by turning off oxygen while the patient was still conscious.
I've made allegations of very serious matters like murder and manslaughter by doctors, by one particular doctor, where I think it's a very clear case of murder and perhaps manslaughter in a second case. I haven't been approached by anyone about that.
The former police officer says the whole health regulatory system is failing. And even when regulators get involved, there's rarely an appropriate outcome ensuring public safety.
When the board made decisions that I felt weren't appropriate, or what they would say to me, look, Jo, we don't have the resources to investigate this, all I could say to them was, that's not appropriate. You know, what are we doing? What is the board doing if it's not here to protect the public?
Last month, Jo Barber went on Brisbane radio with her allegations. Since then, the state's Crime and Misconduct Commission has met and corresponded with her, but it needs her cooperation to investigate her allegations.
Without those details and specifics, no investigation, I'm sure you'll understand, can gain traction. And so I'm urging her to come forward and give us those things so that an investigation can commence.
Jo Barber says she hasn't provided the detailed allegations to the CMC because she doesn't trust it. She's supported by former MP Rob Messenger.
The CMC said to Jo Barber that they will cooperate and refer her allegations onto other entities and other investigative agencies. What they don't seem to be realising is they're admitting that they are going to cooperate with the very authorities that Jo Barber alleges have failed their duty and have covered up these crimes.
What I say to her is it must be apparent that I am no friend of doctors alleged to have been grossly incompetent, and so I give her my assurance that what she brings to us will be examined appropriately.
Ross Martin was the prosecutor who sent Queensland's infamous surgeon Dr Jayant Patel to jail in 2010. He now heads the corruption watchdog. She's made grave allegations of murder, manslaughter, serious misconduct, all going unpunished. Are such instances even possible in a post-Patel Queensland?
One would hope not, but it's important to examine these sorts of allegations to see if indeed they are so.
In 2010, the Bundaberg surgeon Dr Patel was convicted of the manslaughter of 3 patients and the grievous bodily harm of another.
I'd just like to ask him why he done it, when there was no need to, sort of thing, you know. It's like he's buggered up my life for no reason. Didn't have to do it with the operation at all.
It's vindication and it's relief, but the price that you have to pay is too great, and we shouldn't have to do that.
Rob Messenger was an independent member of state parliament until the recent Queensland election. He came to prominence in March 2005 for exposing Dr Jayant Patel in Parliament. He's helping Jo Barber, and together they're forming a company to help corporations deal with whistleblowing matters. For Mr Messenger, Ms Barber's claims are every bit as serious as those against Patel.
One of the big themes that's emerging from this is that the only thing that Queensland Health have learnt from Jayant Patel is how to make the cover-up better.
Jo Barber and Rob Messenger have written a report detailing their allegations. and earlier this week bypassed the CMC and gave it and other material to Queensland's Parliamentary Crime and Misconduct Committee.
And I want the PCMC to look seriously or closely at my complaints and decide whether or not it needs a wider investigation. In fact, I'm not even sure the PCMC will have full jurisdiction to investigate something like this or the powers to do it. I personally believe that the breadth of the staggering the level of complaints or the number of complaints that I've made probably would be better dealt with by a Royal Commission.
In her report, she makes many allegations. 75 doctors were being monitored for health impairments, including brain injuries, alcohol and drug addiction. 10 to 15 doctors who had sexually assaulted patients. Numerous complaints over a decade about a doctor regularly hitting or manhandling unruly children. A Queensland government spokesman wouldn't respond directly to the allegations, but he says Joe Barber's allegations need to be tested. Another claim by the former investigator is that Medical Board of Queensland member Professor Peter Woodruff said Dr Jayant Patel's crimes were not uncommon.
And he would regularly say to senior staff of the Medical Board, myself and my director, Lisa Pritchard, and I believe he's even said it in front of the CEO, that Dr Patel was not the worst doctor Queensland had seen. He was aware of other bad doctors in the state, many of them worse than Patel. And when we would ask him to tell us the name of those doctors, he'd say, no, I'll be okay.
Joe Barber left the Medical Board of Queensland in mid-2010. It's been taken over by the Medical Board of Australia, which says it's introduced more stringent public protections and mandatory reporting requirements. In a statement, Professor Woodruff, now the chair of the Queensland Board of the Medical Board of Australia, responded to Joe Barber's allegations, saying, he may well have discussed Dr Patel with the then CEO of the former Medical Board of Queensland, but any comments made about Dr Patel would have been in the context of the wider work of the board in dealing with allegations of the most serious unprofessional conduct. He added that the board acted to protect the public whenever it was aware of allegations of serious misconduct by medical practitioners. The Parliamentary Crime and Misconduct Committee has now given Joe Barber's report to the CMC. Can she and other potential whistleblowers trust the CMC to do its job?
Absolutely.
How do they know that?
The CMC has a long history of examining matters of this sort. It abides by the rule of law, so that not every case results in prosecutions and matters of that sort. But it is structured, its singular function is to examine these things, and it does so.
When she left the Medical Board of Queensland, Joe Barber was given a glowing reference. Without your hard work and dedication, it said, the board's achievements would be few. It is for this reason that your work has been greatly appreciated and will not be forgotten. It's that dedication, she says, is now compelling her to speak out.
It weighed on me very heavily, and really at some point I had to say to myself, you know this is not working, Joe. You know people are still being harmed. You need to make a choice. Do you really want to hang on to this career? Or do you want to do what you know is right? And at some point I said I had to do. You know, it became so overwhelming, I think, in so many people, I had to go forward.
John Taylor with that report.